More than 1,200 Valley residents have been infected with COVID-19 since March. Our hospitals have stayed ahead of any outbreaks, and joining us today to talk about the outbreak and the planning and all that, Doctors Hospital at Renaissance, is Dr. Manish Singh and Dr. Cardenas. Thank you both for being with us.
Thank you for having us. Happy to be here.
Great to be here, Oscar.
And I'd like to start off with you, Dr. Singh. Evaluate the reopening of elective procedures and surgeries. You're about 2 weeks into it. How is that proceeding, and DHR's ability to keep everyone safe while taking on that outpatient work?
DHR has been taken pride of serving the community of Rio Grande Valley. Safety of our patients and staff are very important. So we have created a very strong protocols and policies in place, which includes testing, providing the PPE, so that the patients feel safe, including the staff. And it has been doing well. We have been ramping up our surgeries, and we are proud of what we are doing right now.
You know, in a recent interview with Dr. Robert Martinez with DHR Health, he explained the registration process, and he mentioned patients would be testing, as you just mentioned, Dr. Singh. So how is that working out with regards, again, with the patient being registered, tested, and then scheduled for that procedure, Dr. Singh?
So all the procedures, including simple procedures and surgeries, they are all go through the pre-admission testing. They all get tested, and we educate the patients. We tell them what to expect when they come to the hospital. That gives them a peace of mind, and it also ensures the safety. We also take pride in taking care of all the emergencies, surgeries, emergency deliveries, and all of them are being doing well in a safe and secure manner.
So to you, Dr. Cardenas, what happens with those test results? Are they sent to the county, and do they become part of the overall testing picture for the county?
Right. So as Dr. Singh mentioned, the testing is part of the preparation for getting ready for an elective procedure, or if you have a symptom. So any testing that's done, when we have the report, we pass that on to the attending physician, the primary care physician, and then negative or positive, that test result is passed on to the county.
So talk to us about antibody testing. When we spoke with Dr. Martinez recently, he expressed some caution about the testing when we spoke with him. One of the concerns, the variability in interpretation or accuracy of those results. So to you, Dr. Cardenas, the testing at that time, he tells us, would help identify who is at higher risk for the virus, or at least a reinfection, who may be well enough to be put on the front line in the event of a surge, and who could be a possible donor to treat critical COVID patients. Is there an update on the status of that antibody testing?
Right. So part of the issue with antibody testing is that it's very, many tests are available in the community, and there hasn't been a definite standardization that's out there. We've been using testing here at DHR. We're able to do the antibody testing, but we're able to do it in the confines of a study that we use to determine who might have the plasma we can use to treat somebody who's actively infected with COVID-19. Right now, for all of our employees and our patients, everyone goes through a series of questions that we have as screening criteria. And then, depending upon response to those questions and history, they may be referred to their primary physician, or in the case of an employee, to employee health to go further testing, in which case they might get a PCR test, which is looking for the virus itself.
And so for a majority of the testing that you do with regards to, say, outpatient procedures and surgeries, that is the quick test, right?
Right. We're doing the quick test or a 2-day test prior to your surgery or elective procedure. And if you're acutely ill, we would treat you in our separate emergency department, where you would be seen initially. If you needed to be admitted, you would be admitted to our serious infectious disease unit, which is a special unit that we built just for COVID. And we would be able to test with PCR testing to determine rapidly if you have the infection, yay or nay.
So last week we reported that DHR Health received a limited shipment of the antiviral drug remdesivir. State officials said today 5 more would be sent to the Valley, Hidalgo County getting 1. So trials are underway across the country to test its safety and efficacy against coronavirus. So Dr. Singh, can you give us any idea of how it's working? Are you seeing some positive results?
Yes, you're correct. DHR Health did receive around 40 vials of remdesivir for our patients. And I'm happy to share with you that we used it last weekend on a patient, and the patient is doing very well. So we are very excited, and we are hoping we'll get more of these vials so that we can provide cutting-edge treatment for our patients in the community.
In reading up today on the remdesivir, and as far as the studies being conducted right now, a first phase would be to test it out on the most critical patients, and then there's another phase where they're patients that maybe not as serious as others, and you're getting that first round with the most critical patients. Is that correct?
That's correct. Yes, absolutely. And we are actually planning to start some kind of research so that we can use and be part of this major study which has been done nationwide.
Yeah, because this is being done all across the country. It's a trial. Yes. There's nothing to treat coronavirus, so you guys are on the cutting edge of trying to figure out what can work against it, right?
Yes.
Yes.
So for thousands of people out over the Memorial Day weekend, many people not doing the social distancing, the wearing masks, Dr. Cardenas, this is going to you. Going forward, what are some of the things the medical community will be following in terms of tracking any potential surge of cases?
Well, we're going to continue to follow the rate at which people are being tested and whether or not they're positive, and look for that surge in the community should it occur. Here at DHR, we are prepared today for any surge. We've made the preparations beginning on day one when this all started, and really nothing's changed. Our recommendation to everyone in the community is, one, to stay safe. Our biggest weapons against this problem have been the things that we've been talking about over and over again that you keep hearing. Keep your distance, 6 feet. Don't touch your face. Don't touch your mouth, your nose, your eyes. Wash your hands frequently. These are the big major weapons that we have, which are prevention, to prevent this from even happening. But here at DHR, we stand ready. We have a COVID task force that meets around the clock as needed and necessary. We have a separate emergency department to deal with those who are ill. And we have a separate hospitalization unit that's completely equipped to deal with any eventuality needed for a patient who has COVID-19 and is very ill or sick.
All right, Dr. Manish Singh, Executive Officer of DHR Health, and Dr. Carlos Cardenas, Chairman of the Board at DHR Health. We thank you both for joining us, and also our thanks to the DHR Health team for doing everything they're doing as well. Stay safe.
Thank you.
Thank you.